undergoing a profound transformation driven by technological advancements. These changes have transformed patient care, operational efficiency, and data management. And in this dynamic landscape, tech consulting firms are critical, helping healthcare providers leverage cutting edge technologies to enhance services, reduce costs, and improve patient outcomes as well. From digital health solutions to artificial intelligence, tech consulting firms have become indispensable partners in modern healthcare, offering expertise in navigating the complex technological ecosystems. Hello, everyone, and welcome back to Analytics Insight podcast, where we bring you conversations at the intersection of technology, innovation, and impact. And I'm your host, Priya Dialani. From intelligent automation to real time analytics and low code platforms to responsible AI, tech consulting partners are not just optimizing healthcare systems, they are reimagining the very foundation of care delivery. And in an industry where stakes are high and inefficiencies are costly, this transformation couldn't come at a more crucial time. Let's welcome Unmesh Srivastava, Managing Partner at Incuvio Health, to help us understand more about how healthcare systems are evolving and the role of tech consulting here. Hi, Unmesh, how are you doing?
Hey Priya, good morning. I'm doing well. How are you doing?
Great. Thank you so much. I'm doing good too, Unmesh. It's a pleasure to have you with us on our podcast today. And, while healthcare has been one of the most sensitive sectors, I would say, in terms of, deploying AI and related technologies, we will be, of course, discussing the role of a tech consulting partners and how they're playing a key role in helping the healthcare institutions adopt these technologies wisely and effectively. But, before we dive into our core discussion today, let's start by, letting our listeners understand and know more about Incuvio Health, a very interesting name, I must say. So if you could help us understand more about the organization, its specialization, it would be great.
Absolutely. Well, at Incuvio Health, we are building integrated technology as well as healthcare strategy firm. We are not only strategic partners to our clients, we are also very deep in execution. We have a total of around 80 consultants onshore, and we've got a offshore delivery center as well in India, through which we are able to not just strategize, but also execute on large scale digital transformation, technology enablement, and bringing operational efficiencies, because no optimizing of operations at healthcare firms doesn't happen without technology. So we built a very special organization there. One of our superpowers is that the folks we have at Incuvio, they've come out of very large and small startup payer and provider organizations where they understand, and they worked in the trenches. So we have folks from who worked at Blue Cross Blue Shield, United Healthcare, Optum, Humana, and we also have a lot of startup talent who has built startup from the past. I mean, I've been a serial startup builder myself. So what makes it very interesting with what we do at Incuvio is we've got a very strong talent layer at the strategy level. So we can go into payer and provider organizations who are taking risk, who are in fee-for-service settings, identify what needs to be improved on the operational side, what are their strategic priorities, come up with a roadmap for the executive team, for the board, to show them how we can transform the organization. And then we actually deploy folks within the business process, within the operations, and within the technology operations in order to completely transform the go. And we are vendor agnostic, which helps us because we want to bring the best solutions in front of our clients as we go into execution.
Great. Thank you for that detailed overview, Unmesh. And your specialization clearly shows the depth of expertise you bring to the industry. And I think our listeners will really appreciate that context as we move forward in our conversation. And, with that foundation in place, let's dive a little deeper into your role as well. You are a visionary leader in healthcare innovation with 2 decades of experience across health systems, technology startups, and payer provider partnerships. So we would like to know more about you, Unmesh. How has the journey been till date? And what exactly is your role and contributions towards the company?
Yeah, well, I'm leading the ship here at Incuvio. I've got, almost 2 decades of experience in US healthcare. I've worked for both big and small companies and know complexities of both sides. And I've also worked in both payer and provider settings. So I started out at Kaiser Permanente, which is one of the premier health systems in the country, then moved on to a smaller organization called North American Medical Management and Prime Care, small medical group based out of Southern California, as well as MSO, which was taking risk. We ended up, doing a M&A and being acquired by Optum and UnitedHealth Group. So I spent, a little over 8 years of my career with UnitedHealth Group, both on the medical group side and spent some time on their insurance side as well. Post that, I built, I was CTO for a startup called P3 Health Partners. In 4 years, we took the company public through a SPAC merger. Post that, I was building Clever Care Health Plan, which is a Medicare Advantage health plan startup. And then post that, I started Incuvio. So been in the industry for years. I understand the complexity. I also understand that you see a lot of consulting firms who end up building your strategy, but are not involved in execution. And a lot of times, where the real rubber meets the road is actually the execution. So knowing that, I wanted to start a firm that not just provides the strategy and transformation and, for the board and for the executive team, but also, gets deep on execution. Yeah. And my day-to-day role is really building a strong team and helping us find the right organizations to help and scale.
Great. Thank you for sharing that, Unmesh. And it's truly insightful to hear about your journey and pretty fascinating, I must say. Very impressive. And I'm glad to, hear how your role goes beyond just the responsibilities and is really about driving, the impact across the organization and the industry. Moving ahead, now, the next thing that I really want to talk about is the traditional risk adjustment models. Now, for years, I think providers and payers have used risk adjustment factor scores to project care cost predominantly in Medicare Advantage risk adjustment programs. However, the traditional RAF scores often depend heavily on historical claims data, and they miss critical insights such as social determinants of health, like housing and education. So as value based care models continue to gain traction, one thing becomes crystal clear, that is, traditional risk adjustment models are struggling to keep up. So, why do you think that these traditional risk adjustment models are, failing payers and providers, and how do you think AI can help here?
Yes. So, the latest on Medicare risk adjustment, we are now in version 28, risk adjustment, version 28 HCC coding and version 28 RAF. And with version 28, the coding, the way the providers would perform, their day-to-day coding and documentation has shifted from the previous models. And I think, traditionally it was all claims driven, but I think these days it's super critical. I mean, the whole goal with risk adjustment is to make sure that the providers and are doing accurate compliant coding for the members that they are seeing or for their patients. And then that translates into the risk adjustment factor, which gets them, the required payments in the financial year model. We've been seeing a lot of AI has been implemented in the Medicare risk adjustment space. And there's so much data these days. There's claims data, there's chart data, there's so many venues of service. So, the patients are going to a hospital, they're going to a specialist facility, they're going to pharmacies, labs, they're going to primary care. So there's data created in all these different spaces, which can actually help the clinicians make a very informed decision on what to code at the point of care. What AI is doing now in this risk adjustment space is really, one concatenating the data from various places of service, from the labs and pharmacies and, the primary care specialist, hospitals, acute care, post-acute care facilities. And then on top of that, with AI, the inferencing has become much more powerful. So now you can actually pull charts from national registries and perform, the right level of inferencing on top with right machine learning algorithms and even like integrated generative AI to come up with inferences of diagnosis, which, if presented appropriately at the point of care, can actually help the clinicians and providers to get a better view of, a more 360 view around that particular patient they are seeing. So I think it directly impacts their coding accuracy. And I think that's a huge win compared to the previous models and compared to the old days where everything was claims driven. Now you can actually ingest a ton of data and build that inferencing and provide that level of intelligence as clinical decision support to the doctors, which is very helpful.
That's truly insightful. And, thank you for sharing that perspective, to be honest, because what you have highlighted is, I think, exactly where the industry is struggling because traditional models simply weren't designed to handle today's complexity that we are facing, specifically in the healthcare. And I think it's very clear that AI is stepping in to fill those gaps. And I think what's interesting also here is not just the accuracy that AI brings, but also its ability to scale, personalize, continuously learn, which kind of ultimately benefits both payers and providers as well. And of course, with AI and generative AI coming into picture, I think digital transformation in healthcare rely a lot on data driven technology to improve patient safety as well and the overall outcomes, if I would say, because it's not unusual for larger organizations to routinely juggle information between 800 to 1000 applications across diverse siloed IT systems. And each new technology solution requires a large amount of resources. You need specialized personnel to implement and maintain and different systems, and of course, and there's an overall increased cost of technology as well. So I think this presents a heavy burden on healthcare professionals time, energy, as well as available capital. Now, something that's been gaining a lot of limelight in an AI driven world that we are living is the importance of low code platforms. So how do you think that low code platforms are helping in the hospital and clinical and operational settings?
Yeah. Well, low code is the new normal, I feel like. The thing is that change management, especially in this day and age, right? The payment models in healthcare are changing. There's a lot of system roll-ups happening. The operational and clinical teams need to innovate fairly quickly and also be ready to individualize care at a patient level, right? And for that, there's a ongoing need for them to actually update their systems and their workflows. And the traditional SDLC model that a lot of these large technology companies, SaaS incumbents have been using, it doesn't work anymore. If I'm a health system or I'm a payer who wants to make certain changes and build more functionality for my own internal teams or have more patient facing or provider facing functionality ready, I need it fast. And the waterfall model of SDLC just doesn't allow it. If you work with traditional large vendors, you have to put in the request. It will go into their queue. They will let you know if this is part of their roadmap or not. If it is part of the roadmap and you're lucky, you'll get it in 6 months to a year. If it's not part of roadmap or they're not willing to do it because this will not help other clients of theirs, your updates will not see the light of the day, right? And I think that's why low code plus AI driven platforms are so much more important these days because the speed to market and individuality that the systems are looking for that's a table stakes when you build something like this. So I think that's why it's critical. And I've seen a ton of, new and upcoming software companies or even the innovative larger organizations are moving their platforms towards both AI native and low code to avoid that, to provide that flexibility and speed to market. So I think that's super critical. There's large incumbents like Salesforce and Dynamics and who have been in this low code and AI space and are getting deeper and deeper. They're startups. There's one that I'm deeply involved with called Curitex Health, which we are also building in the same vein, which is, low code, no code AI platform for healthcare. You'll see more and more of this as AI gets deeper and takes more shape.
Definitely. I think I agree with you. And, it is, I think what stands out with low code platforms is that, they empower healthcare teams now, whether it's clinicians building workflows without relying heavily on IT or admins streamlining operations to improve patient outcomes. It's really fascinating to see, technology enabling that level of agility in such a critical sector. And you have rightly highlighted that in your response, Unmesh. Moving ahead, in earlier of your responses, you mentioned about having a holistic view of the patient outcome and helping in understanding the patient history and, the progress. Technology, I think the healthcare industry is rapidly transforming, and it is now playing or, placing a strong emphasis on enhancing patient outcomes and improving the operational efficiency side by side. So that's the reason care coordinated solutions have emerged as vital tools for healthcare providers to streamline patient care across various services and ensure seamless integration. Now, but when care is fragmented, I think patients pay the price, especially for chronic conditions or elderly patients navigating multiple specialists. And I think this lack of a unified view can, lead to missed interventions, duplicated tests, or even dangerous oversights for that matter. So why do you think that a unified platform is no longer optional in coordinated care?
Yeah, I mean, you gave the answers in your question. It is exactly that, right? The disease burden, when for highly complex patients, the disease burden is high. They're meeting their specialist, they're meeting PCPs, they are sometimes going to multiple specialists, right? And different systems of record, just and the lack of interoperability between these systems just creates more and more complexity. So I think you must have heard of the term patient 360, right? Or a unified patient record. That's how it has to be. You can no longer have data sitting in silos in these different transactional systems with walls or fiefdoms which don't share the data between each other. So I think hence it's super important having a common data layer, having a longitudinal patient record, having a data warehouse where you can share data from all these transactional systems back and forth, where you can maintain a unified patient record. What it can do is it can be so powerful because now you've got data in one common place, concatenated in a single view, and you can actually push it back at the point of service, at the point of care, across the care continuum. You can send the same historical and a 360 record to the specialist, PCP, to the hospital who is looking at the patient. And once they have that view, they can better coordinate care. And also for care management teams, right? A lot of these risk bearing entities, payers or providers, they have internal care management teams who are managing care across continuum and being that buddy for that patient across the continuum. And they have to have access to this data to see what is happening in all these different care settings for their patients. So I think fragmentation doesn't work anymore. Coordinated unified platform is what folks need, which is unified by data and the back end.
Definitely. And I think when we talk about a unified platform, it's like a single pane of glass that it's not only for the patient journey, but also for every stakeholder involved in delivering that particular care. And when built right, I think it acts as both a real-time operating layer and a strategic decision engine as well. Moving ahead, AI and generative AI, I think we have discussed about it. And to be honest, I think it can touch virtually every industry. But I think the technology could also pose unique challenges for healthcare and life sciences specifically. Now, the use of AI in diagnostics or decision making, even claims processing, for example, I think it could lead to new risks related to patient care, safety, and discrimination. And instilling sustainable trust in AI could also be a significant hurdle for organizations because issues related to trust have historically slowed the adoption of new technologies. I think it's pretty much evident from the start of the Industrial Revolution in the early 1700s to the computing revolution in the last century. So, how do you think that organizations can balance innovation and trust when deploying AI in healthcare settings?
Well, I think it just starts with explainability and governance, right? There has to be, when AI, especially generative AI, comes up with certain recommendations, there should be explainability around that. And that's how people will trust what the AI is producing, especially in the clinical setting, right? If you're telling a doctor, hey, this might be a suspect diagnosis code, well, how did you get to that? You need to then we have to explain like what is the data lineage, which chart did the AI look at and say, well, this might be a potential condition on the member, right? So that, and then just the overall governance of AI, where it's a huge change and it has to be governed well. Otherwise, there will be lack of trust at the user level. I really think AI should augment, not replace human judgment. When the clinicians and administrators they understand why a recommendation was made, adoption goes up and the trust follows right after. So I think innovation or AI without trust is it's just a risk. So I feel like responsible AI really means transparency, validation and human oversight based on a day to day as you're driving the implementation. So as long as we can manage that change management and build that explainability, I feel like AI can really help in the clinical setting and the deployment in a clinical setting.
Definitely. And I think that's a very grounded way to look at it. Because trust isn't just a compliance checkbox. I think it's a continuous relationship. And especially when AI is involved in diagnosis or triage, or, like your explainability and accountability must be, built in from day one. And I think that really highlights that we are at a critical inflection point in enterprise technology because generative AI is no longer future ambition. I think it is a present reality. Yet, for many organizations, early pilots remain just that, just pilots. And progress has stalled not because of lack of ambition, but due to fragmentation and over reliance on isolated efforts. So, you spoke about, ensuring responsible AI and deploying AI responsibly. But what does it takes to responsibly scale AI across providers, plans, and systems?
And that's a great question. I mean, I feel like AI is the new buzzword, right? That everyone wants to use. And a lot of what we call pilot to death is happening in this AI space because executives and teams are not able to see what it can do at scale, whether it is implementing machine learning or generative AI or agentic AI, right? There's a lot of pilots happening, but you still don't see it at scale in large settings. I really feel like there are three key ingredients for this scaling, right? One is there has to be a solid foundation of data and interoperability, right? Like data has to exist. Only then AI is a reality. Structured, unstructured, but all at a single place. Second is a proper governance framework around AI that can ensure compliance and safety because healthcare in the US is very compliance driven. And, sometimes if things are not explainable, it's not in line with high trust and HIPAA and all of the other compliances that we need in healthcare. And that's critical, SOX and whatnot. And then a very clear linkage to outcomes, right? At scale. So yes, I'm implementing agentic AI. Will that improve my, member engagement? What are the clear metrics around that? How is it going to impact my star and HEDIS performance? Is it improving my accuracy by what percentage? So I think if we are putting the proper measurements in place, right, and outcomes and tracking that, I think it will become much more easier to scale and really see where we are doing well and where we are not doing well. And then, take your decisions accordingly. So I feel like if your AI strategy and implementation is measurable, governable, and adaptable, it will scale. And I've seen examples of that at Kaiser, at what we were doing at Optum. We did implement a lot of machine learning at scale, and it actually had a very profound impact on the operations, where it was actually helping our day-to-day teams run a better operation. So definitely there's a process to it, and if you don't follow it, you're going to see more pilot to deaths.
Definitely. And I think that as you wrap up our conversation today, it's very clear that the healthcare sector is at the forefront of a technological revolution, and tech consulting firms are driving much of this change because they are helping healthcare providers, improve patient care, reduce costs, and even secure sensitive data by providing expertise in implementing these advanced technologies effectively and responsibly. And I think the pace of innovation, regulatory scrutiny, and rising stakeholder expectations also demand a new playbook. Well, thank you so much, Unmesh, for taking out the time and effort to be on a podcast today and helping us understand that enterprise AI must deliver on three dimensions. It must be safer, faster, and more accurate. And that's a tall order for anyone who is willing to, improve its efficiency, but it's achievable only through strategic partnerships. So, thank you so much for being on a podcast today. It was lovely chatting with you.
Yeah, same here. Thank you for having me, Priya.
Thank you so much. So, this is for our listeners. Thank you so much for tuning in to this episode of Analytics Insight. And I'm your host, Priya Dialani. And we'll be back soon with more conversations that matter. Till then, you can view all our previous podcasts on Spotify and other leading platforms. Until then, stay curious and keep innovating. Thank you so much.